play on the bottom. Okay.
Yeah, I think I see them running on the side, and then, yeah, I'm familiar with StreamYard, so you'll bring them up on the screen there.
Yeah.
Perfect.
So we'll just do a little warm up with your introduction, and then we'll invite. Did you see the thumbnail of the topic?
I don't think I did.
Okay, it's Lindy, can you pop the thumbnail up, or she probably can. It basically was a picture of you, and it said, "Clogged arteries is not the real cause of heart disease and stroke."
Okay. Well,
So I
I'm
guess we're
good
going to be
wherever the
talking about metabolic
conversation.
health and
Yep,
inflammation.
I'm good wherever we end up going with the conversation.
We
Okay,
are live.
sounds good. Okay, thank you. Hi, everybody. This is Phil, and I'm here with Dr. Philip Ovadia tonight. He is a cardiothoracic surgeon from the Tampa Bay area, like me. And we're going to be talking about the hearts tonight. But Dr. Ovadia, could you give a little background of you?
Sure thing. And it is great to be back here with the Steak and Butter Gang. Always fun when we get together. And I know Bella couldn't join us this evening, but seeing everyone else here, and this is, I think, my first time kind of meeting the other Dr. Phil, or two of the other Dr. Phils, I guess. And we both happen to live near each other. So I am a still practicing heart surgeon. Actually just got back into town a few hours ago after being at a hospital in Alabama operating all week. But also run a telemedicine practice, nationwide concierge telemedicine practice focused on prevention, keeping people off the operating table. That's the name of my book, Stay Off My Operating Table. And I am doing a little multitasking. I got to get 200 of these books signed tonight for some of my practice members. So if you see me kind of looking down intermittently, just know that that's what I'm doing. But great to be here, and happy to talk about what are the true causes of heart disease and what we can do to keep everyone off the operating table.
Great. So we may get some other questions from other topics, so feel free to boot those to the rest of the team. So we'll be mixing it up a little. So
yeah,
but,
I'm happy to talk about just about anything metabolic health, carnivore related, or anything else you want to ask me about.
Okay.
I don't worry about getting banned on YouTube or anything like that anymore. So it was open book with me.
Great. Now, I know from your book that you had tremendous battle with your weight and your metabolic health yourself. And what led you to choose to go carnivore?
Yeah, so I think, like a lot of people in the audience and a lot of practitioners in the space, right, this started with me recognizing how unhealthy I was. I was morbidly obese, pre-diabetic heart surgeon, and I knew that I was going to end up on my own operating table, so to speak. I was traveling down that same path that so many of my patients had gone down. And like so many of them, I didn't know what to do about it, right? Because I think I was doing a pretty good job of following the advice that I had learned. I know you probably learned the same stuff, right? That you would tell our patients, eat less, move more, follow the food guidelines, eat a low-fat diet. And the only place that had gotten me was more and more obese throughout my life. I really struggled with obesity going back to childhood. So I had to kind of step back and start asking some different questions, start to think about things in some different ways. Had some, maybe what some people would call fortunate encounters along the way, although I think it really is sort of when you're ready to learn new information, the information finds you. So my journey started at actually, ironically enough, a Society of Thoracic Surgeons meeting where Dr. Gary Taubes, or sorry, not doctor, but Gary Taubes happened to be the guest speakers. And he had just written at that time the case against sugar. And, I heard him talk. It made a lot of sense. I read his books. I started cutting out sugar, kind of went low carb, and had a lot of success, lost a lot of weight, was feeling great. And then I heard about Carnivore. And as I kind of reflected on things, I was like, well, I'm pretty much there. I was doing very low carb keto at that point, eating some veggies and, some other stuff. But I said, let me give Carnivore a try. And while I had pretty much already lost all the weight I needed to lose at that time, I still had some persistent inflammation issues, particularly for me, plantar fasciitis. Just plagued me for, probably a good year to maybe even 2 years at that point. And I went Carnivore. That resolved almost immediately. I remember like my third day on Carnivore, I got out of bed in the morning, and for the first time, my foot didn't hurt. And so that's what kind of got me here. And then I've kind of stayed here now, and that was now going back almost, we'll be at 8 years in March, 7.5 years. I've been doing a primarily carnivore diet just because it's easy. Honestly, I have a very busy life. Operate, run a practice, father, husband, all the stuff. And I just enjoy Carnivore because I don't have to really think about it. Find some meat, find some eggs, some seafood, and go ahead and you're all set. So that's my background. Yep.
Super. So let's bring in Coach Raymond, who Coach Raymond and Bella and you was one of the first videos I ever saw on Carnivore, where you were discussing Coach Raymond's calcium scores through the years. And you were giving him some reassurance that his trajectory was actually flattening out and not accelerating. So I'll never forget that. And that's why I bought your book. So I do want to plug your book. You want to hold it up again? Stay off my operating table.
Stay off my operating table. Thankfully, Ray is still here with us. So I guess
Yes.
gotten something right.
Yes.
Or more importantly, he's gotten something very right over the years. And always awesome to see you again, Ray.
Yes.
So we're also going to bring in Todd. So let's go ahead and bring him in, and we'll start to take some questions.
Perfect.
So Lindy, if you could start putting some questions up for us.
Oh, I got you.
Or are you doing it, Todd?
Do we need to tell everybody how to raise questions, or we think we got it?
Just if you have a question, put QQQ in front of it in the comments, and we'll get to it. And we will prioritize any super chats. So the first one, 5 months in, eating 24 ounces of ground beef daily, 1 to 2 sticks of butter. I'm doing 3 MADs, 3 meals a day. Gained 20 pounds, though I don't feel stuffed after eating. How do I know if I'm eating too much? Actually, this is a good Coach Raymond question.
It is. It's actually a great question. How do you know if you're eating too much? The biggest part about eating is whether you're feeling uncomfortable afterwards. This is why I like to use a comfortably stuffed method, right? So what do I mean by that? Do you feel uncomfortable afterwards? You feel bloated? You still feel empty? You still feel like you could eat more? And that's very well known for people who have who's just starving all the time. What I would do instead of trying to stuff yourself more with 3 meals is perhaps go to 4 meals or 5 meals, but stay under. So we all have a tolerance point. Our tolerance point as we eat, if we go over that tolerance point, then we're not digesting as well either. So sometimes you might have to go back a little bit, allow your body to be able to digest, even if the hunger is strong there. Just make sure you just add more meals. Instead, wait an hour, maybe a couple hours, and eat again, but a smaller portion. So that may actually help you. Just a warning, though, for these people who are that kind of ravenous hunger, it does take a while before it subsides, but it will. I was one of them. The pretty much deep. It looked like bottomless hole.
Yeah, and this is a
Okay.
great question, to really understand that, the context around it, right? And we don't know all the context here, but some things to be thinking about is your body doesn't really think about how much you're eating, right? Your body is solely focused on getting the nutrients that it needs, the fuel that it needs, right? And if you're still hungry, it means that you're not getting something that you need. Now, a lot of people come to, metabolic health, carnivore, low carb, whatever it might be, and they are just years and years of chronic malnutrition, right? And you can be overweight and still be malnutrition, right? You haven't gotten the nutrients that you need. And, this sort of, what seems like insatiable hunger, what that means is, your body is still trying to get caught up with things. So like Ray said, it will settle down over time, but you got to get your body to where it wants to be, which is it is satisfied from a nutritional standpoint, from a nutrient standpoint, and then you'll kind of start to find your set point.
Okay, thank you. Okay, from Debbie, CAC score is 1,675, CT angiogram done, then heart cath with 60-70% blockage reported, no stents installed. Keto since January of 21, thinking carnivore may be better. Dr. Ovadia, what do you think?
Yeah, so, a lot in this question, and for some of the context here, for people, hopefully understand some of what we're talking about here. But CAC, this is the coronary artery calcium score, very important screening test when it comes to your heart health. Definitely recommend pretty much any man over 40 and any woman over 50 has a CAC scan to know where they stand regarding their heart health. 1,675 is what I would put in the moderate to high, level of calcified plaque. Now, the CAC score, it only tells us about the calcified plaque, doesn't tell us about non-calcified plaque, and it doesn't tell us how significant your blockages may be. In general, the higher your CAC, the more likely it is that you have what we would consider to be a significant blockage. The CT angiogram that Debbie mentions is typically the next test that I'm going to recommend if we have concerns. The CT angiogram will show you non-calcified plaque in addition to the calcified plaque, and it will show you how narrowed the blood vessels are. And it sounds like it was probably suggestive of at least a moderate blockage. And then you went on and had a heart cath, which is an invasive study. They put a catheter through the artery in your wrist, typically, sometimes through the artery in your groin. We go into the blood vessels of the heart itself, and we inject dye directly, and we can see how blocked up they are. And if need be, we can put a stent at that time. Now, you have some blockage. It wasn't bad enough to need a stent. That's good. And the goal now needs to be, we got to make sure it's not getting worse. And hopefully we can get it to get a little better. And it is possible to undo some blockage in the arteries. I have patients in my practice who are seeing their scores on CAC scores, for instance, go down some. But the most important thing is let's stop it from getting worse. And to know why it's getting worse, that's where you really got to dig into. You've been doing keto since 2021. That's great, but you got to check the blood work. You got to make sure that your insulin resistance has resolved. Some people, it takes a long period of time. Some people, you know, the version of keto that they've been doing maybe wasn't quite, you know, the right one or the one that they needed. Sometimes going to carnivore and even lower carb may be appropriate. Sometimes there's something else within the keto diet that's causing an autoimmune and inflammation reaction that carnivore may resolve. But insulin resistance and inflammation are the two primary drivers of heart disease. Related to that, I think it's very important to know your cholesterol quality. Remember, I didn't say how much cholesterol you had. I said, what is your cholesterol quantity? And that comes from looking at some of the advanced lipid testing and finding a good physician who understands all that and can help you work through it is very important in situations like this. You know, having a comprehensive team, I always say, is important, right? On my team, we have great health coaches. We have, you know, my nurse practitioner, we have me, but it is a team effort and it takes that whole team. But, you know, some people, I understand, right, that there's maybe rightfully so some skepticism about doctors these days and what they're saying, right, in the mainstream. But, you know, this is a situation where you do have significant disease and you got to find a good doctor to work with on it.
Okay. And how do you meet patients virtually or only in person?
Yeah, so my practice is telemedicine only. I am licensed. I'm just about to get the last of the 50 states, but we'll soon be licensed in all 50 states. But we see patients in all 50 states and internationally, and it's all telemedicine. And you can just go to ifixhearts.com, hit the talk button, and set up a call with my team to discuss if you're interested in medical care.
Okay, thank you. And Lonnie Lee does our first of many lipid questions tonight, so we'll probably see a lot of this. So when you're answering it, maybe you can make some generalization. I know one thing I liked about your book is talking about the fact that half the patients you operate on for coronary artery disease have totally normal lipids, which brings back to the point that it's inflammation and insulin resistance is the problem. So Lanny says my triglycerides are 94, which is normal. These are US units. HDL is 90, which is nice and high. LDL is 190, which is considered high on lab test results. Her hemoglobin A1C is 5.8, which is a little borderline high. I'm 95% carnivore, but still eat fruit and non-starchy veggies. How do I lower my triglycerides?
Yeah, so, you know, the first thing I would say, Lonnie, is the triglycerides aren't necessarily the number that concerns me most here. It's the A1C of 5.8, which is in the pre-diabetic range and may be problematic. Now, you know, I do see a lot of people who their A1C hangs around 5.7, 5.8. And it may not be all that problematic. So with someone like yourself, what I would typically want to do first is put a continuous glucose monitor on, see what's happening with your blood sugars, see if the fruit and the non-starchy veggies that you're eating are causing a glucose response. See if maybe you're just one of these people that your glucose runs at a little bit of an elevated level, let's say like 110 range. You know, it's pretty steady. You're not spiking throughout the day, but it's just kind of running around 110. And if you want to lower it, oftentimes the approach there is you got to eat more fat. Because what I sometimes see in people that are lean or are relatively lean compared to what they used to be, they've already lost a fair amount of weight. The body isn't really willing to give up much more of the body fat. And you're eating a lot of protein and you're eating not quite enough fat to meet your energy needs. And so the body's going to start using some of that protein that you're eating as an energy source. And it does that by converting it to glucose, called gluconeogenesis. And that will cause your blood sugar to run a little bit higher. Now, again, if you're not having the spikes, I don't think that that's a problematic situation necessarily. But if you want to get the blood sugar a little lower, and the triglycerides will usually go along with that and come down as well, the answer is usually eat more fat, maybe dial back the protein a little bit. And, I would certainly, at least on a trial basis, consider cutting out the fruit and the veggies and really do kind of a strict carnivore approach and see what happens with that. And again, doing that all while you're wearing a continuous glucose monitor is kind of the best way, the most efficient way to figure that all out, because you're going to see exactly what your body's doing all the time.
Great. Okay, Todd. Miniwa, who's diabetic, she says, I have pulmonary hypertension. It's a severe category. Besides just eating carnivore, what can I do to help reverse it? And I want to tell you, Dr. Ovadia, she was on continuous oxygen 4 months ago, and now she's only on nocturnal oxygen. So she's already improved dramatically with carnivore way of eating.
Yeah, it sounds like you're already making good progress, and I would continue to do the same. And this, I would maybe want to know some of the more details about if there's an indication about what caused the pulmonary hypertension. I'm going to assume that we've made sure that, you don't have an underlying valve problem or something mechanical that might be contributing to this. I think continuing carnivore, would be first and foremost on my list. I think this is a situation where I might be looking at some targeted supplements that can help with this, particularly something called nitric oxide. And although you can't directly supplement nitric oxide because it's too unstable a molecule, you can give your body the precursor that it needs to make more nitric oxide. And I would be looking at that route. Menwa added that she has untreated sleep apnea. You certainly want to, you said I had, so I'm assuming that it's treated now, and that will help. Those would probably be the big things that I would be thinking about to start with. I would, like I said, just definitely continue doing carnivore. It sounds like you've already had great results. And then look into adding a nitric oxide precursor supplementation. I don't really endorse any particular brand, but I will say Dr. Nathan Bryan is kind of at the forefront of the science. He had a book that came out not too long ago that I might have somewhere around me, but I don't have totally handy, and it's called something it's something about nitric oxide in the title. I forget the exact title of it. And he has a supplement product that I have a lot of patients using, and seems to deliver some decent results. So that would kind of be the ways that I would be pointed. The secret of nitric oxide, I see someone dropped it in the chat there. So yeah, that would be a good one to start with.
Great. And from Diane, how do I know when I have too much fat? Let's give this one to Todd.
Yeah, I'd love to hear his perspective.
Yeah, I think, at first it's a little bit hard to tell because you are going to have, if you're new to carnivore, you can have digestive issues. But ultimately, the goal is to eat fat until you don't taste it anymore, until you don't have a taste for it anymore. But sometimes you can get, digestive issues before then. So up until you can get to that point, you got to kind of ride that line of what we call disaster pants, having a little bit of diarrhea until you're, until your signaling gets better, until you finally eat enough that your body doesn't want it anymore. Now I'm to the point where I can be eating a steak and eating the fat, and it tastes like the best thing I've ever eaten. And then all of a sudden, a switch will just flip, and I don't want another bite of it. And that's when I know that I've had enough fat.
So, Raymond, do you think people can get too much fat once they're adapted?
Yeah, well, that's the thing. If you get too much fat, you will feel it. The disaster pants, just like Todd said. There's other things that you'll get. It's a little more bloated. Again, it's all about the tolerance. So we all have a tolerance to fats also. So some people can handle a lot of fats, and just like Bella, she'll eat a ribeye steak and have a stick of butter and no problems, right? But some people, even a little bit of fat starts making them bloated. Find your tolerance and flirt with that, but don't go over too much. Your tolerance.
Okay, super. Dr. Ovadia, you want to add anything to this?
No, I would just, I think Ray makes a great point, right? You know, we love Bella, but we're not all Bella. And listen, I can't eat like Bella eats, right? And there's nothing wrong with that. You know, nutrition becomes a very personalized thing, and we all got to kind of find where our, you know, best point is. And it's just something that you really got to experiment with and pay attention to. The signals from your body, first and foremost, are going to tell you what you need to do.
Yeah, and I think in our experience, most people are under eating fat, not overeating fat. So
Yeah,
that's
I mean,
probably the
that's
biggest problem we see.
Yeah, it's generally what I see as well. You know, if you're eating a carnivore diet, there is a decent chance that you're under eating fat, right? We think of carnivore as high fat, but it really isn't, because, you know, it's high fat when compared to the low fat sort of programming that we've all had throughout our lives. But remember, you know, most of the meat we get, especially here in the US, is still very heavily trimmed, and there's a lot of fat that they've cut off of it. And so, you know, even what we think of as a fatty ribeye steak, you know, is probably still only going to be 1-to-1 in terms of grams of fat to grams of protein. And a therapeutic ketogenic diet, as it was kind of originally described, is, you know, going to be at least 2-to-1, maybe even 3-to-1 on grams of fat to grams of protein. So most of us don't get close to that. If anyone's ever actually tried to do a therapeutic ketogenic diet, it's challenging. You know, you really got to eat almost pure fat. And so most of us don't get there. Most of us don't need to get there, but that's just some context for the concept of too much fat.
So I met one person in my life. She was a med student colleague of mine, and she used to cross-country ski across the state of Alaska every year. And they did 30 days, nothing but butter. So that got you ketogenic.
Yep, that will do it.
Okay, Sandy says 7 weeks carnivore. I have gallstones and had gallbladder and pancreatic pain. Doctor insisted I start a brat diet and recommends gallbladder removal. I just want to not make the same mistake. I am scared. You want to handle this, or would you like me to?
This is part 2 here.
Oh, mistake was too much fat in one sitting. Pain was sharp. It lasted a few minutes, then went away. Scared of stone getting stuck in a duck.
Yeah, so ultimately, gallstones don't come from the fat that we're eating. And in fact, you know, eating too little fat can cause problems, because, you know, you want your gallbladder to be emptying, essentially, and kind of cleaning it out. And when you eat too little fat and the gallbladder isn't stimulated, that's when we can start to get problems with gallstone formation, as well as some other issues. Oxalates, for instance, play a role in gallstone formation as well. You might want to think about, you know, I would want to know, you know, is your gallbladder functioning properly? The presence of stones in and of itself isn't necessarily everything we need to know about the gallbladder. There's some other testing that can be done to know if your gallbladder is actually able to contract well and empty itself. You can ask your doctor about that. There are some supplements that sometimes help people as they're transitioning. You usually don't need these long term, but again, if you're coming from sort of a low fat background and all of a sudden you've introduced, all this fat at once, your body might need more of a gradual introduction, gradual kind of ramp up of the fat level. And like I said, sometimes some supplements, the two that I would typically recommend in this area, you can get an ox bile supplement. And then there's a supplement called TUDCA, TUDCA. It's trans-ursidecolic acid, something along those lines. But those can be some good ones to help with gallbladder issues if you're having them. And like I said, it may just be, in this case, I wouldn't jump to taking out your gallbladder. I would maybe kind of try a more gradual fat increase and maybe try some of those supplements and see if that can get you through without having to take your gallbladder out.
Super. Diane says, I have an 800 calcium score. How can I help that? My doctor is sending me for a CT angiogram.
Yeah, great question, Diane. So yeah, 800 is a level that we at least have some concern. I think a CT angiogram is an appropriate thing in that situation. And then again, how do you help it? You have to know what's driving it in the first place. So do you have insulin resistance? Do you have inflammation? Do you have periodontal disease? Do you have some other environmental cause of toxicity, right? One of the things that I've been seeing more and more of in my patients are things like mold toxicities, heavy metal toxicities, chronic unrecognized infections like Lyme disease. These things can all contribute to heart disease. And the problem is, in the mainstream system, we really only look at one thing, and we don't even look at that well, right? We think that cholesterol is driving the problem. And I always say cholesterol is part of the problem, but it doesn't drive the problem. It doesn't cause the heart disease. But looking at, again, your cholesterol quality can be important and can be informative. It's usually if you have poor quality cholesterol, meaning that you have a lot of the small, dense particles, that reflects an underlying problem. Usually, again, going back to insulin resistance or inflammation. But at least that can start to get you some of the, point you in the right direction. Unfortunately, the mainstream approach to this is lower your cholesterol with pharmaceuticals, and that doesn't end up working all that well. A lot of those people still end up on my operating table and many other operating tables, and it's just, it's not attacking the right part of the problem. So I think you're getting the appropriate testing, but you gotta kind of push your doctor. What is the root cause? And if all they can say is cholesterol, might be time to find another doctor.
So let's take this the next step. And she has a high CAC score. Let's say she has a single lesion, not needing any kind of intervention. What kind of follow-up would you recommend for Diane?
Yeah, so I am a big fan of serial imaging. So I like to get follow-up CAC scans. Usually it's going to be 1 year for someone like this in my practice. Because whatever we decide to do, right? If you decide to go carnivore, if you decide to, do some other form of a metabolically healthy diet, or if you decide to take statins, right? Whatever you decide, I want to know if it's working or not. And the best indicator that we have is follow that progression of the coronary calcium score. The calcium score is a low radiation test. I have no problem with doing it year after year after year on patients. Now, you know, you do it a few years in a row and it's been stable and you're not changing your routine any, yeah, you can space it out and do it every couple of years. It is fine. But at the beginning, whatever we're doing, I want to know if it's working or not. And if it's not working, we got to figure out why, right? And again, I see this, and the inclination is to say, oh, it must be the diet that's the problem. And sometimes it is, but a lot of times it isn't, right? And you got to keep digging deeper. Like I said, I've now discovered a lot of patients that have other non-dietary issues going on that we get to that root cause. Now we can finally get the heart disease to, you know, stop getting worse.
Okay, so what has been your most effective way to get people to reshift their mind from their LDL cholesterol to inflammation and insulin resistance? And how do your colleagues respond to it?
Yeah, you know, it really does come down to, you know, understanding and explaining, you know, why the insulin resistant is important, and using a tool like a continuous glucose monitor to kind of show them what the insulin resistance is, right? It's very powerful when you see, you know, your blood sugar spiking up and then crashing down and spiking up again. So the CGM is a great tool. You know, in some ways I'm fortunate, right? Patients seek me out now because of this. So a lot of times they're already convinced, and I just have to kind of reassure them, right? Because they have been so scared or programmed by their traditional doctors that, you know, cholesterol is the problem and eating dietary cholesterol is the problem. Now, understand, saturated fat and dietary cholesterol have been absolutely 100%. I have no problem saying this. They are not a cause of heart disease. The studies do not show them to be a contributor to heart disease. They never did. And despite, you know, this is a myth that got persistent in medicine, but we can go all the way back to, I know Ancel Keys, you know, gets blamed for a lot of this. But when you really look at Ancel Keys' science, he himself, you know, showed that it wasn't dietary cholesterol and it wasn't dietary saturated fat that were causing problems. You know, there was some misinterpretation, I'll say, of some data that he was looking at, and as well as others at the time, that led them to believe that blood cholesterol levels were an issue. They're really not. You know, like I said, they are in the sense of, if you have poor quality cholesterol, cholesterol's problematic. But just because you have high cholesterol doesn't mean you have a problem. And that's what I spend a lot of time sort of undoing these days. But you know, that's where we're at. And like I said, if you're not getting good responses from your doctor, one of the great one of the great advantages that we have today that maybe we didn't in the past is, you know, you have a greater, you know, you have more choices when it comes to who your doctor is. You know, we have telemedicine. You don't have to be stuck with your local doctors necessarily. Now, admittedly, right, maybe your insurance doesn't cover it. Oftentimes it won't, but these are worthwhile investments in your health ultimately.
Super. Thanks for covering that. So Tom or Nina, I don't know which one. I have an ascending 3.8. Oh, this is Nina. I have an ascending 3.8 aortic aneurysm and mitral valve, probably insufficiency, moderate.
Yeah.
CAC score 0. Her CT angiogram, picture perfect. Problem is standing up, dizzy and bending over, extreme tiredness. What should I do to improve?
Yeah, so my recommendation would be to figure out why you're having that. And it probably is not anything that you listed here related to your heart, right? So CAC score is 0, CT angiogram perfect. That means you don't have blockages in your arteries. Your ascending aorta is 3.8 centimeters. That's depending on how big you are, but I'm going to guess by the picture that, that's a little bit large for you, but not to the point where we'd be thinking about doing surgery or anything like that. And typically, moderate leakage of the mitral valve is not going to cause those types of symptoms. So something else is going on. Do you have a neurogenic sort of issue, right? That when you're standing up or bending over, your blood vessels aren't sort of keeping up with that, and they're not kind of squeezing down quickly enough. That's something we call vasovagal syndrome. And, although we're still, I would say, trying to figure out what exactly causes that, it seems to have to do with the balance of our autonomic nervous system. So the autonomic nervous system, you'll hear it called the sympathetic and parasympathetic, and that can be get out of balance. And why that happens, sometimes we're not exactly sure, but it seems to maybe be related to some autoimmune stuff, some inflammation, some neurologic stuff. And therefore, I do know a number of patients that have seen good benefits from, keto carnivore type approaches to this. When we're dealing with neurologic issues, ketosis can become more important. And again, this is one of the cautions, not a caution, but just one of the adjustments that you might have to make within a carnivore framework is it's not always highly ketogenic. And some of these situations, some of the neurologic situations are situations where you do want to get a highly ketogenic kind of form of animal-based diet that's going to involve, like I said, a lot more fat and maybe dialing back the protein some. But those are the things that I'd be playing around with. Look at your electrolyte status. That can play a role in this as well. I would want to know, what is your blood pressure at baseline? Does it drop when you stand up? Something you can do called a tilt test in the doctor's office, where they kind of put you on a table and they measure your blood pressure, and then they kind of almost stand you on your head and measure your blood pressure again. We now have some great tools. I use one called a BioBeat. It's basically a sticker you put on your chest, and it measures your blood pressure every, I think it's every 3 minutes, I want to say, throughout the day. But you wear it for 24 hours and you'll see what your blood pressure is doing exactly through the day. So that might be a tool that I would use in a situation like this to try and figure out, what's going on here.
Okay, thank you. From Olivia Casellas, I have severe itching, have tried the teas for the oxalate dumping. What else can be going on? Any other recommendations to help alleviate? Let's go to Raymond first on this one.
Yeah, I'm glad you've tried the teas. Now, what I would really recommend is go to the expert on that. Sally K. Norton talks a lot about oxalates. So, and believe it or not, some people, teas is just not enough. It's not strong enough. So black tea, she actually talks about calcium, some kind of calcium citrate to actually help. But definitely read her book, get a good idea and understanding of oxalates. And I think that's probably the best place to go to.
Okay. Do you have any other tools that you recommend? I know she recommends.
I would also be thinking about histamines, and histamines can be an issue that are going to be causing itching, and histamines can come from meats that have been aged longer, and some different cuts can be more problematic when it comes to histamine. So you can try and sort of, and again, there are plenty of resources out there about sort of low histamine approaches within a carnivore framework. You can also, just as a test, I wouldn't do this long term, but you can take a antihistamine, medication, see if that resolves the itching. And if it does, it might point you to, this is a histamine issue. And then you got to kind of figure out how to work around that.
In Steak and Butter Gang, we have a lot of people that have histamine issues, and we have a open chat where many people discuss how they've overcome their histamine. So if you of the Steak and Butter Gang, please consider coming to open chat. And if you're not a member, it might be a good time to join, because we can help you with that. Okay, thank you, boomers on two wheels. I guess this is someone my age on a motorcycle. So thanks for the super chat. My CAC score is 1800. I feel fine, no chest pain or shortness of breath. Active job, I'm 64. What should I do next, Dr. Ovadia?
Yeah, this is a great question. And, symptoms are a very important part of the puzzle here. So, we talked about earlier the CT angiogram to get more detail about, how much soft plaque you might have and how narrow the blood vessels are. And I kind of mentioned the concept of significant blockages. And what a significant blockage really comes down to is it meaningfully reducing the amount of blood that can get through it? And there are some different ways to kind of start to figure that out. But symptoms become very important. If you're active and you're not experiencing symptoms, it usually is going to indicate that you don't have, a blockage that we're going to need to treat with a stent. Now, I still always kind of favor, let's get all the data we can. And a CT angiogram would be a great, tool in this situation. And then along with, again, figure out, why did that plaque accumulate? Is it actively accumulating, right? So your CAC score is 1800. How long ago was that done? If it's been a year, I would want to get another one and see, is it still going up? Or is this, accumulated damage from the past? We have a little bit of a problem within the carnivore low carb community, in that, most people don't hear about CAC scans until they come into this world, it seems. For whatever reason, it's just not widely promoted, although this is getting a little better, but it's still not widely promoted in sort of the mainstream medical world. So most people get their first scan, when they're already doing low carb carnivore, right? And then the question is, everyone's like, oh, well, is this because of the low carb carnivore? Now, again, when you think about it sort of logically, if you've had 60 years of not being carnivore, and you've had a year or two of being carnivore, and you're seeing a CAC score that's high, it probably had to do with the other 60 years and not the more recent 2 years. But now we got to do some work to kind of try and figure that out.
Thank you. So Joanne asks, what are your thoughts on an angiogram?
Yeah, so I've mentioned the CT angiogram a number of times. I think she might be asking about a cardiac angiogram, which will also be called a cardiac catheterization. And that's the invasive version of the test, where they actually go up with the catheter. And I think it can be used and should be used appropriately. But we have non-invasive ways of doing this imaging these days, the CT angiogram, that I think in most situations, I'd rather get a CT angiogram. The exception being, if I have a patient that has symptoms that are strongly suggestive of heart disease, certainly if they're coming in with a heart attack, yeah, go to the angiogram, and then you can potentially treat the issue at that time. But you want to sort of jump right to the definitive test in that situation. For anyone else that's not having symptoms, or you're just sort of trying to figure out how much disease they have, I think a CT angiogram is typically going to be a better test at first.
Okay, and I guess people want to know, would a CT angiogram hurt? What's involved?
Yeah, so the difference between a CAC score and a CT angiogram is that the CAC scan, they don't need to put an IV in you. It literally takes about 5 minutes, pretty quick and easy to do. A CT angiogram, they are going to need to put an IV in your arm. They're going to give you dye through that IV. The other thing to know about a CT angiogram is your heart rate has to be slow enough to do the test, typically under 60. So sometimes we have to give some medication to make sure that the heart rate is slow enough so that we can get the pictures of the heart that we need. It is a little bit of a higher radiation dosage. It's not a massive radiation dosage. I know there's been some stuff recently on social media, kind of, discouraging people from getting the test because of the radiation. And listen, over a lifespan, cumulative radiation exposure is important, but for one CT angiogram, it's not going to be a problem. The amount of excess radiation that you get from a CT angiogram is equivalent to the amount of excess radiation that you get from a cross-country plane flight. So, a lot of us do that, right, on a regular basis. So I don't worry too much about it. And then the final difference and consideration is going to be cost. And yes, your insurance may cover it, but sometimes they don't. A CAC scan, a coronary calcium scan, is typically going to be in the $100 to $200 range, sometimes even a little cheaper than that. A CT angiogram, if you're paying out of pocket for it, I've seen it as inexpensive as around $500, but more typically it ends up in the $1,000 to $2,000 range.
Okay, super. I think we ought to take a moment for the next question, Raymond. Let's pull up the slide, Lindy, of the Transformation Challenge. And would you tell a little bit about what we do in the 90-day challenge?
Yeah. So in the Steak and Butter Gang, this is a community base. What we do, we have a 90-day transformation challenge, and of course, you can win up to $2,000. What we do is we have a set form of calendars that we get folks just trying out carnivore and testing their carnivore skills, trying to get them fully nourished, and we test that with a version of fasting. So, and we see how far you can get, and we talk about more of a non-scale victory, more than a scale victory. And let's see what you can do. The important part is to stay through for the 90 days. We've had some incredible transformation in 90 days. And bet the real transformation is what really happens more inside than outside. So please join us. If anything, just to have a community. This is a wonderful community. We have a great, caring, and big community there.
And Todd, can you talk a little bit about our second annual Montana meetup?
Absolutely. Yep, we had our first annual one this 4th of July. It was fantastic, and it's already off to a great start for 2026. And so it's right here in my hometown, Bozeman, Montana. And it's through the 4th and 5th of July. Everybody on your screen is going to be there as speakers, and we're collecting more as we go. And this one is, we're trying to do it a little bit different than some of these. It's more of a social event. We do have a Q&A, and we also have a VIP dinner so that you'll have some more intimate time with the doctors to ask your questions. But even more so, it's a social event for the 4th of July, just a giant barbecue with lots of fireworks, and bring in, celebrate our Independence Day and just kind of fellowship together, and for everybody to have time to chat and meet everybody as for a local community. So it's going to be fantastic. But check it out at sbg.events.
So, and I understand, Dr. Ovadia, you're going to be joining us in the Steak and Butter Gang to do a Q&A coming up in October. Is that right?
I believe so. I never quite know what's on the calendar until I get there. But yeah, I think we have some other things coming up. And if you don't mind me plugging one more event, I know Bella's going to be there. I'll be there. Hack Your Health coming up in Tampa in November. It's going to be a great convention, not necessarily strictly carnivore, but very carnivore heavy. Myself, Bella, Ray, I think you're on one of the panels, right? Dr. Sean Baker is going to be there. Many of the other kind of community leaders will be there, and it should be a great conference. And in our hometown of Tampa, both Phil and I, so we'd love to see people there. And I don't, you guys probably have a discount code within Steak and Butter Gang that you can use, and we have one as well. So hope to see many people there.
Yeah, and just go to hackyourhealth.com, and the code is carnivore in capital letters, and it's $100 off, and we hope you can make it. And we're planning to do a special SBG luncheon at noon on Saturday. So we hope those of you coming will choose to join us. So we'll be getting that information out later. So I think we have time for probably one more question, Todd. Is pork, Diane asks, is pork and chicken okay with carnivore? Raymond.
Wow, I mean, it's definitely carnivore. I don't see a problem with that. The only thing is, the question is whether your body can handle it. If you have no problems with that, then I say enjoy it. Pork can make a delicious side dish. Now, a lot of carnivores tend to lean to red meat, but that's just because after a while of doing that, we just feel like pork and chicken are not as superior as red meat, whether it's lamb or whether it's beef.
Hey, thanks. And Todd, let's do one more. Can you pull up Debbie Olive Tree?
Yeah, let me go find it.
So I'll read it. Debbie says, doctor wants to put me on statins. My ApoB is 143. My LDL is 188. My lipo-A is less than 6. My CT angiogram, 2 valves, 5%, 1 valve, 20%, plaque, 1 valve clear.
Yes, I assume you're talking about your vessels, not valves, on the CT angiogram. So again, the key piece of information that's missing from this, you talk about ApoB, LDL levels, and even Lp(a), but we don't know the quality of your cholesterol, and we don't know if you're insulin resistant or not, and whether or not you have inflammation. That's all key information that I would want to know before I talk to my patients about what should be done. Lipid lowering therapy, statins, PCSK9 inhibitors, bempedoic acid, ezetimibe. These are all pharmaceutical options for lipid lowering. Lipid lowering has only been shown to be beneficial in patients that are insulin resistant or have inflammation. And so if you don't, there is going to be no benefit to lowering your cholesterol. And so that's why I focus so much on insulin resistance, inflammation, quality of your cholesterol, which becomes a reflection of that. And that is the information that you really need to determine ultimately whether you want to go the approach of pharmaceutical lipid lowering or something else. Now, again, I always tell people, if you do have insulin resistance and you do have inflammation, yes, there is going to be some benefit to pharmaceutical lowering of your lipids, but it comes with a trade-off. All of these things have side effects. And I think a much better approach to take in that situation is improve your metabolic health with, let's say, a carnivore diet, and then you don't have to worry about it because you're going to be in that category now that you no longer benefit from lipid lowering.
Thank you. So we really appreciate having you tonight. are there any upcoming events other than Hack Your Health that you'd like to promote, Dr. Ovadia?
Yeah, so Hack Your Health is the big one, next big one coming up for me. I will have a new book coming out next year, and it's not quite ready for pre-order yet, but it will be by Hack Your Health, and I certainly will appreciate people kind of following me, looking out for that. But again, if anyone wants to kind of keep up with what we're up to, iFixHearts everywhere. You can go to ifixhearts.com, iFixHearts on all the social medias. And my current book, my first book, Stay Off My Operating Table. My podcast by the same name, Stay Off My Operating Table. And always appreciate everyone's support on that.
Well, thank you so much. And on behalf of Bella, who couldn't be with us tonight, and Coach Raymond and Todd, I thank you for your time, and I hope everyone on the call really benefited. So have a great night, everyone.
Have a good night, guys.
Thank you.
Thanks, Dr. Ovadia. Thanks, Dr. Phil.
See ya.